Now that we've got the medication out of the package and we've determined that it has not expired and it is colorless as it should be, the next step is to actually remove the medication, the individual dosage, and you want to be careful as you're pulling it out because you don't want to break apart this part right down here because that's where the medicine will come out. So you see as I broke apart just one, and then you're going to want to make sure that you do put the rest of those in the foil fairly shortly. So once I have that open, I haven't opened this part yet, so the medication is still inside of the plastic. I'm going to go to this apparatus right here, which is where the medicine is going to be stored and where it is going to be dispersed from when the nebulizer is running. So as you can see, there's actually two parts to this. There's a little green cone that goes on inside, and the next thing you're going to do is actually open the medication, and you don't want to be putting any pressure right here with your fingers as you're twisting this because sometimes it'll squirt out, and obviously you don't want to do that. You want the medicine to get inside of the person that's intended for. So just very gently twist without putting pressure with your fingers. Keep twisting until it comes off all the way. Then you pour it into here. Just like that. And then you're going to connect these pieces. You don't want to just shove it. With this particular one, you want to just gently twist it, and it's on there snug. And then you've got the medication in here. It's ready to be hooked up and used.